It is never the wrong time for us women to talk about our health and what resources are available to us. But with Breast Cancer Awareness Month starting just days away, there's even a bigger push to be educated. That is why today we are going to learn about the breast health program at TMC and how they take a multidisciplinary team approach to breast problems. Dr. Michelle Lay is a part of that team and she is joining me now. Doctor, thank you so much for coming.
Thank you so much for having me today.
Let's kind of dive into what that means to have a multidisciplinary approach and a team that does that.
So we know that when you have a team of doctors, and this goes from everything from the doctor who diagnoses your cancer, and that's usually two different doctors, a radiologist and a pathologist. The radiologist is the one that takes the pictures and does the biopsy, and the pathologist is the one that looks at the tissue, making the diagnosis to coming up with a treatment plan. That's the surgeon, the medical oncologist, radiation oncologist, and delivering the care. When you have a team of doctors, we know that you do better in the long run. You live longer and have better outcomes in terms of having less side effects from your treatment. And so that's why we practice multidisciplinary care.
I think it's, like I said at the very beginning, it's perfect that we're always keeping a conversation open. We're always knowing what's available to us, what resources, what's the best care that we could possibly get. So I know we're going to be covering a lot of that today. One of those being, how do I know as a patient that I'm seeing a specialist?
So that's very hard because your primary care doctor, if you feel a lump or you have an abnormal mammogram, your primary care doctor probably sends you to a general surgeon or to whomever they're used to sending patients to for breast problems. But that doesn't necessarily mean the person they've sent you to is a breast expert. And I'm one of just a handful of fellowship-trained breast surgeons in the entire state. And so it's important that you ask your surgeon or whomever you're referred to is, are you fellowship-trained? Is this something that you specialize in? Most medical oncologists nowadays have a specialty focus in a particular kind of cancer. Maybe they take care of pancreatic cancer more than they take care of breast cancer. And then you can ask the surgeon, is this what you primarily do, or do you do other kinds of cancers, or do you take care of a lot of cancer, or do you mainly do general surgery? But it's hard when you're diagnosed because you're scared and you don't know, you're so scared that you don't take the time to think about those questions, but it's really important to ask those hard questions of the people that you're going to see, because you could end up having the wrong treatment for your cancer if you don't ask those good questions up front.
So those are some of the questions that we want to ask, you know, about the fellowship, about your specialty.
Right.
Is there any other questions? Like you said, it's a situation that you've never been in before.
Correct.
You don't know what to do, and so much is going on that you're not thinking about it. Are there maybe other questions we should be asking that we don't forget?
I usually want patients to ask their doctors, you know, how often do you treat this disease? That's one thing. So there are general surgeons that do a lot of breast cancer care, and it could be that that's the majority of what they do, and that's probably a good option. But then you want to also ask doctors, are there options out there that you don't offer? So some surgeons may do a lot of breast cancer treatment, but there are some procedures that they don't offer. And same thing with medical oncologists and radiation oncologists. Maybe there are treatments that are out there, but they don't offer them yet, or it's just not something that they feel comfortable with. So that's another thing. Are there treatments that you know about but you don't offer? So those are the other things that I talk to patients, that you want to have patients ask their provider.
Now, speaking of those, are there maybe some new treatment options out there, maybe even when it comes to mastectomies and other things that we may have that we can know offhand?
So I think there are two things that are really important to know about breast surgery. You know, sentinel lymph node biopsy has been around for more than 15 years now, so pretty much every general surgeon knows how to do that. But nipple-sparing mastectomy is something that has been around for a long time, but not every surgeon does it. It's a harder way to do a mastectomy. It takes longer, and you need some specialized kind of training and patience in order to do it because it's a harder operation. And you need a team with a plastic surgeon also. You need to team up with a plastic surgeon to do that. So nipple-sparing mastectomy is one. And then the other is oncoplastic breast surgery, where you're moving around the breast tissue and using specialized techniques to make the breast look as natural as possible after you remove the breast cancer. And so those are things that you are good for patients to ask about. I find that sometimes patients end up getting a mastectomy when they could have had a lumpectomy with oncoplastic techniques. but they've went to someone who doesn't offer those techniques, and so that person, you know, that other surgeon may say, well, I can't do it because it's too much tissue to be removed and you just need a mastectomy. Whereas in another person's hands, maybe they could have had breast conservation and saved the breast. So those are some good things to ask about.
This is exactly why we're having you on, Doctor, exactly why we have these types of conversations, so that you have this information, you know what to ask, you know that there's other options out there. And like I said, it's never the wrong time for us to talk about this, but I know with the Breast Cancer Awareness Month coming up, we're diving even deeper into that, and knowing that we have like this team that's available for us out at TMC. I'm going to remind everybody how they can even get more information beyond this, but Doctor, I want to thank you for this important information.
Thank you so much for having me.
Absolutely. For more information about the TMC For Women Breast Health Program, call 324-BREAST. That's 324-2778, or visit tmcaz.com/boys-lay.